Alright, hi everyone again. So let us see the third quiz, that is Lens and Cataract part 2 and Retina part 1. Let us start this quiz in the same manner if I was giving the test instead of you. So I'm ready. Let's start with the first question. The first is a 10-year-old boy with diminution of vision with occasional double vision was examined in eye clinic. A crescent was seen on dilated pupil examination between the phakic and aphakic. By this, you should know that phakic aphakic crescent means there is a subluxation of lens. The decreased vision or the symptoms here is due to astigmatism, but not corneal astigmatism, due to lens astigmatism. That is subluxation of lens. Can be seen in many conditions like Marfan syndrome, aniridia, blunt trauma, homocystinuria, hyperlipidemia, and S. Stickler syndrome, sulfite oxidase deficiency, sclerotic cataract. Maths, we can remember as maths because we are good in maths. That's why we took biology. Now, very important question. There's a left fundus picture showing some black pigments, that is bony specules, arterial attenuation. That is most common retinal dystrophy, retinitis pigmentosa. It is inherited dystrophy of rods and cones. B is not the first wave affected. It is affecting the rods and cones. So A wave of the ERG is first decreased, then B wave. But electrooculogram will be normal. And yes, there is a triad of association. It can be associated with posterior subcapsular cataract, that is complicated cataract, keratoconus, open angle glaucoma. No reason for that, but you have to remember this. And two vitamins are given: vitamin A, docoxahexaquinoic acid, just to decrease progression, but no ultimate treatment, no definite treatment of any dystrophy. Now, which of the following retina cells is found in a different location? You should know the layers of the retina. See, horizontal, molar, bipolar, and amacrine are present in inner nuclear layer, while ganglion is not in the inner nuclear layer, and that is the answer of this question. While this is also now this picture compromises actually three layers of the retina. This is the rod actually, because this is looking like a cylinder rod. Now, in the cylinder rod, this is the nucleus, that is the outer nuclear layer, the box area. This is the segments. In between the segments and the nucleus, there is a outer limiting layer. So this is rod. Yes, box area is not inner nucleus, it's the outer nuclear layer. Rod is not present in the fovea. Rods are everywhere in the retina, not at the fovea. That's why the number are more than cones, 120 million. And vitamin A is required for its function. That is also correct. A 60-year-old person complains of a ring-like floater in visual space. When he moves his eyes, it also moves. So when something is there in the vitreous cavity causing a single ring-like floater, a single ring in the vitreous cavity is suggestive of complete posterior vitreous detachment, that is, Weis ring is the answer. Wesley ring is seen in any type of keratitis, that is immunological reaction, immune ring. Can be seen in fungus, acanthamoeba, bacteria, even virus. Schaffer sign is seen in rheumatogenic detachment. Pigments are released from the retina hole, dispersed in the vitreous cavity like a tobacco dust appearance. While Amsler sign is seen in fuchs uveitis, that is bleeding in the antechamber on paracentesis, means incision in the antechamber in fuchs heterochromic iridocyclitis. Here the answer is B's. Now this is the left fundus photography. This part is the center part of the retina, foveola, fovea, then macula. While arteriovenous ratio is 2 is to 3, so green is artery, the lumen is narrow, then the lumen of yellow, that is vein. The question is, green mark is retinal artery, true. Yellow is present in inner retinal layers, true, because the central retinal vessels are present in the inner 6 layers of the retina. They are intraretinal vessels. White arrows does not have blood supply from retinal vasculature, true. It is getting nutrition from the choroid. And white is slightly dark because melanin pigment, xanthophyll pigment are maximum in the fovea. While endothelium of the green mark vessels forms the outer barrier, no, it forms the inner barrier. Outer barrier is formed by the RP layer and the Brooks membrane. Brooks is the first layer of choroid, so this is the wrong statement and the correct answer. Now, which of the following is not a subjective? Subjective test, Snellen's. Whenever you see from the center part of the eye, center part of the retina is a macular function test. Like form sense from Snellen's chart, color sense, contrast sense for Paley-Robson, photostress to differentiate macular versus optic nerve disorders. Multifocal ERG is also macular function test, but not a subjective one, it is an objective one. Now this is what? This is not a fundus photography. This is a right autofluorescence because dye is not present in the optic disc and the retina vessels. This is autofluorescence. Dye is not used, so this is not angiography. Answer is nota. Nota पता होना चाहिए. Exam वोट देते हैं. None of the above. That is the answer over here. Nota. You can't be asked stages of angiography, but you should be knowing what is the difference between angio versus auto. In angio, dye is used, so either retina vessels or the optic disc will have the dye. Here, dye is not used, so retina vessels and optic disc are absolutely dark. So this is autofluorescence. Answer is nota. So that's it. 8 questions. I hope you have done well. Best wishes.